Kristen, you talked earlier about getting a test at your doctor, a heart test, but a lot of that information may not be helpful in determining whether or not you're at risk. What should somebody do or ask for? What kind of tests might be more valuable, I guess?
I would say certainly a C-reactive protein, CRP, a measurement and a marker for inflammation. Dr. Paul Ridker at Harvard University, Brigham and Women's Hospital, is the one who brought that to our attention. And it's a blood test called HSCRP. If you are elevated, then you have to do things to determine what's causing the elevation. And obesity is one, arthritis is another, smoking is a big one. But once you become aware at the risk that you have, for instance, in the physician health study, they found that if you had an elevation in C-reactive protein, you had a 300% increased risk of a heart attack over 6 years. And if you had an elevation in LDL, in combination with the C-reactive, your risk factor went up 500 times. So that's a good place to start. Have a calcium score evaluation. Many people I've encouraged to have the score. It's about a 4.5-minute test. Many of them, in spite of the fact that they weighed 265 pounds like one individual, had zero calcification. Other people would be shocked and find out that their risk was incredible. Anything over 400 gives you a 10-time heart attack risk, and it goes up from there. So once they determine that, they know that the calcification will eventually close your artery, or it could involve the disruption of plaque. Inflammation is critical in all diseases. It's at the basis of chronic disease, even cancer. At the time that I made it my subtitle, I didn't know it was going to become that prevalent. You know. So there are certainly a thallium treadmill. I don't know how many people have gone in and had a thallium treadmill and found out that they had 2 arteries or 3 arteries that were compromised, and they had to go in and have a stent. A lot of times now they're aggressively using medication to reverse some of it. But if you have a seriously blocked artery, you don't want to fool with it.